Takes a lot to get me in the chair at the dentist's office, but Dr. Matt Vandermolen promises me it's going to be fine. We're at Advanced Dental Care here in Springfield, and as we age, I think it's natural that we want to take care of ourselves, our hair, our skin, our eyes. I don't think too many of us think about our teeth very often, but it's not only a big part of our look, but a big part of our health.
Yeah, absolutely. I mean, the psychologists tell us that the first thing you notice about a person is their eyes, and then number two is the teeth and their smile.
So how do you address that when someone walks in, maybe a little starting to get concerned about their smile? What are I don't even know the options. Like, what can we do to improve it other than whitening and using certain toothpastes? What can you do as a dentist to make a difference long term?
Right. So I meet a lot of patients, mature patients especially. They've gone through life and they almost have this acceptance that, hey, I'm getting old, so my teeth are going to start looking old. And the problem is we have a lot of restorations and things that get old too, and nothing lasts forever. So what people don't understand is that when you're trying to brush and everything and it just doesn't come out right, you may have underlying infection. And that infection in the mouth is also linked to diabetes, heart disease, and strokes.
Are there things we need to worry about, a certain patching or filling or just trying to cover up a bad exterior that you shouldn't do, that you have to worry about some of those other things first before you start?
Right. So patch and fill dentistry has its place. I mean, when you have an emergency situation to do that. But really, you want to look at the mouth as part of your whole body, and that if there's something going on in one particular spot, there's probably things going on in your whole mouth. So if you treat the whole mouth and do whole mouth dentistry, it's just better for your whole body. I mean, a lot of things are going on in not your particular mouth, but just your mouth in general that are affecting your whole body. It's bringing you down. And a lot of people, once we treat the disease and take care of things, just in general, they feel a lot better. And it's because they're not fighting the infections and all the bad things that are going on in their teeth.
I would imagine it's maybe like painting the inside of a house. If you have a leak and you see some damage, you paint over the top of it, make sure think it looks okay, but it's really not okay.
Right.
Talk about some of the serious effects that one could have in their body if they just decided to ignore the symptoms and try to cover over the exterior.
Right, so a lot of medicine now is turned to inflammation, and so if you have inflammation in your mouth, that inflames your whole system, your whole body, and so that's what I was talking about with the stroke, diabetes, heart attacks are all linked to this types of inflammation. So it's good to have good dental health, to have good overall health.
So if someone wants to start that process with you, what does that look like from when they walk in the door for their first consultation? I know it's different for everyone, but what can they sort of expect in steps along the way?
Basically, we're going to take lots of x-rays and lots of photographs and really study how their teeth work together with their jaws, and then come up with a complete plan. And sometimes people feel like, well, if I have to have complete dentistry, I have to have it done all at once. And that's not true. Everything didn't happen overnight, so we don't have to fix it overnight. But you really should know what's going on and be able to have a plan for everything so that eventually you can get everything done properly.
Can you just whiten the top half and not the bottom half? Is that?
Well, you could, and a lot of people do, and that's a start. And that's all that I'm asking patients is to come in, let's get started. And once you understand what's going on, I'm sure you'll want to go forward and get everything taken care of.
Well, it sounds relatively painless, which is good. That's the part that I don't like, is the uncomfortability. And if you have questions, we'll connect you with Dr. Vandermolen here at Advanced Dental Care in Springfield through our website. Just go to ciLiving.tv, and I'm going to let him get started poking around.